Hey guys, so I wanted to drop this video in regards to the third lockdown that's happening in Toronto. My friend Sean released a video and got a lot of good response to it, and he highlighted how frustrated he was and how a lot of what's going on right now does not make sense in terms of what we're doing. And just some background on that. Him and I have not seen eye to eye on this from the beginning of the pandemic. Admittedly, I thought he uh, didn't take the right approach on some things. I thought that maybe he jumped the gun on some things. And we had some arguments about it back and forth. But I recently messaged him to say that, you know what, I think I was wrong in regards to the lockdowns and how we're approaching the situation. And I don't think that clearly what we're doing right now makes a lot of sense. And I'm going to go through in this video some of the statistics and facts around what we're doing and why it doesn't make sense and why I've changed my mind. So I just want to stress though that at the beginning of this, I was pro lockdown, pro mask, pro social distancing, making sure that we take the precautions necessary. I was about all those things, and I was very adamant about them. I was very vocal about them, and that was because I felt like we didn't have enough information to make an accurate assessment of how we're going to move forward. And I wanted more data. I wanted to figure out things first before we made generalization and jump to conclusions about anything and how we should proceed. And now it's been 14 months and we have that data. We have information that we can look at. We should be concluding how we're going to proceed. We should be changing how we're going to proceed. But we're doing the same thing over and over and over again and getting the same result because it's obvious as why that's going to be. And I'm going to go through some of that stuff. But I wanted to highlight that I'm saying that in the beginning, I felt a certain way. And then I decided to go through all the data and all the statistics and all the information and look at the big picture and say, and what I'm looking at, is that the right way to approach this? And then the more I dive deeper into it, the more I can say that, looking back, maybe at the time that was the right decision to make. But I think for where we are right now, it makes no sense for us to do another lockdown because of all the things associated with that lockdown and the way we're approaching health in general and things around the vaccine and all this other stuff. So my objective in this video, like I said, is to kind of outline that first, where I'm coming from. And I have parents that are 65 and 60. Part of the big reason why in the beginning I was wanting to be very diligent about things is because I'm worried about their health, and I know a lot of people are, and there's a lot of things that we have to consider. But now, like I said, that we have the data, now we can make an assessment and judgment on how to proceed. And so, like I said, in the video, I'm going to go through some of the articles, some of the statistics, and then at the end, I think we need to come up with solutions, right? So in the end, I'm going to kind of talk about a solution related to that. So first of all, what I want to talk about, and I'm going to open up screen share and actually show you guys the article so you can go follow along with me and we can go through this together, because my reasoning here is that we have people that are for the lockdown or against the lockdown, right? But I think we can all agree that the lockdowns are not working, correct? And the other thing that I think we can all agree on is if we're able to come to some sort of herd immunity for this virus, whether, like I said, even if you don't think this virus is serious, or you do think it's serious, or you don't think it's real, or you do think it's real, it doesn't matter. Because if we all get to herd immunity, at the end of the day, if we can get there in a way that we all can agree on, then that achieves the goal and we can all get back to normal. So the long term, or the end goal, if we hit herd immunity and we do it in a way that is beneficial for everybody, works, correct? I think we can all agree on that as well. So like I said, solutions are obviously going to be important, but we need to make sure we're going about getting that way in the right manner. And we can see that through some of the stuff that I'm going to go through, if we look at excess deaths, there is an increase in deaths in the U.S., for example, but a lot of them are attributed to the older population, right? And so I'm going to open up screen share now for you guys. Okay. All right. So first one I want to pull up here is from StatsCan. Okay. Stats Canada. So here we are. We've got, from January to mid-December 2020, there were an estimated 296,000 deaths in Canada, representing an excess of 13,798 deaths above and beyond what would have been expected had there been no pandemic. This is about 5% more deaths than expected in that period after accounting for changes in the population such as aging, and about 7% more deaths than 277,000 observed within the same time frame in 2019. So what this is saying is that there's 5% more deaths year over year than the average, and that is telling us that that's that increase from essentially due to COVID. Now, there's a lot of other factors we could talk about in there. Suicides. We could talk about overdoses. We could talk about the lack of car accidents because there's less people on the road. We could talk about that there may be more incidents of mortality because people aren't getting screenings. Anyway, so let's just say that it's at 5% for the sake of what we're looking at. Now, if we scroll down here a little bit further, so we can see here, overall, during the first months of the pandemic, 86% of excess deaths occurred among individuals aged 65 and older. Similarly, COVID-19 deaths also disproportionately occurred in older populations during the March to early June period. Approximately 94% of the deaths caused by COVID-19 involved individuals 65 or older. So, what this is telling us is that during those periods of time in 2020, we've had an increase of 5% of deaths, of an increase from 2019, 18, whatever, to 2020 has been a 5% increase. Okay. Now we're also seeing that 86% of that was from people that were 65 or older. So meaning that 65 or younger, we basically there's been a less than 1% increase of that age group in terms of excess deaths than a normal year. So we're locking down the entire country for, and this is for people that are 65 and under. They have less than a 1% chance of increasing their death from any other year. Okay, so basically what this is telling us is that we need to be protecting people that are 65 and older, and we got that data initially, but this is confirmation of that after a full year that we need to be protecting those people more so than anybody else. And why is that? Right? The reason is because their immune systems are weaker. Okay, so younger people have stronger immune systems. We know that, right? So we would want people with stronger immune systems to contract this virus if we are going for herd immunity, right? If they have a very, very low risk of something happening to them, we would want them to build up herd immunity through the immune systems that are very healthy and they can handle the virus. Okay, I think that's what that's telling us. Now, with that said, let's move on to the next article. Okay, we've got here, Pfizer says its COVID-19 vaccine is 100% effective in children ages 12 to 15. Okay, so of course it's going to be 100% effective on these children because they're at like zero risk of having an issue. And we'll pull that up actually as well right now here with another article. So this article is from Time Magazine. It was fewer children died in 2020 despite the pandemic. Experts are trying to figure out why. So this goes on to talk about the entire year. It's released January 14th. Okay, we can see here 2021. And so it talks about how there's been deaths in, due to COVID-19. But here we see when broken out by age. However, the data show that fewer children under age 15 died in 2020 compared with prior years, even after accounting for COVID-19 related deaths. Take the US, for example, where about 26,000 child deaths in 2020 have been recorded so far. That's well below the average in recent years, as shown by the chart below. Okay, we won't go into the chart. I'm just going to go over this quickly. So here, in any other year, a continuing decline in child mortality would be good news, but not unexpected. In a year like 2020, it's astonishing. Given the deadlines of COVID-19 and so many demographics, it's incredibly fortunate that children have been largely spared due to their effective immune system response to the virus that causes the disease. In the US, just over 100 children under age 15 died from COVID-19 in 2020. They account for 0.03% of the 376,000 of COVID-19 deaths since the virus hit last spring. That's less than 0.5% of the 26,000 total child deaths from all causes. Now, there's about 75 million kids in the US, and only 100 of them passed away due to COVID-19. Again, because their immune systems are stronger and capable of handling this virus. Okay. So that's not to say that 100 kids dying is not terrible, but when you reflect it against, child dying because of poverty, because of hunger, because of car accidents, because of anything really, you're probably going to come up with a higher number than 100 kids out of 75 million. So what my point is that, when we go back to this, Pfizer says COVID-19 vaccine is 100% effective in children ages 12 to 15. Of course it is, for one, because they're at very, very low risk. And the other side of this, though, that bothers me is that why are we even worried about vaccinating kids when they have such a low risk of having issues with COVID-19, right? Why are we not focused, which I just highlighted, on 65 and older, which account for 86% of all of the excess deaths that occurred in 2020? Now, this is, like I said, this is in the U.S., and I'm just coordinating the U.S., but generally statistics are going to be pretty similar. So why are we worried about vaccinating kids 12 to 15? Okay, because they're the healthy part of the population. Why wouldn't we want people in their 20s to, if they're healthy individuals and they don't have any immune system issues, then why wouldn't we want them to build some natural immunity, to create herd immunity, to then carry forward? Because clearly, like I said, we don't have a lot of issues with children contracting the virus. Okay, so this is what I'm talking about when things don't make sense, right? Like, why like I said, why does it make sense for us to pursue vaccinating children right now? Like, even if it was a significant virus that we were really, really, really worried about, and in terms of like polio or something like that, but kids were not being affected by it, we wouldn't be vaccinating kids. We'd be vaccinating the population that is at risk, which is 65 and older. We've got there are now more patients in Ontario ICUs than at any point during the COVID-19 pandemic. This was December 15, 2020. And now we're seeing those same headlines again. Now, does anybody ever thought about the idea and the concept that because we've been wearing masks for the past year, that is causing more respiratory issues, and now we're seeing younger people having more issues and having to go into ICU, potentially because we're wearing a cloth mask over top of our face? And so you can, there's debate about that and whether, that's factual or not. So I'm going to pull up some facts here. So the first thing, masks cause respiratory issues. You Google that or put that in. Another issue that may come up when wearing masks is allergies. Many allergies have a respiratory component, irritated by dust, pet, dander, and pollen as the country moves into spring, blah, blah, blah. So anyways, you have this essentially right away talking about allergies, how they can play a role relative to masks or whatever, but that's not the biggest point I want to make. I'm just outlining that, there are multiple factors to consider here. But how well do face masks protect against coronavirus? So we see here that the CDC recommends fabric masks for the general public, okay, medical masks for healthcare workers, and medical masks for individuals who are at a higher risk becoming seriously ill, such as people in their 60s and older. Okay, so there's a difference between a medical mask and a fabric-based mask. Okay, so, and we have the CDC here telling us to wear fabric-based masks as a general public. So me and you are going to be wearing fabric masks. Okay, and that's what we've been wearing for the past year. Okay, now I'm going to pull up a study from this is from 2015, University of New South Wales, Science Daily. Okay, this is what it says. The widespread use of cloth masks by healthcare workers may actually put them at an increased risk of respiratory illness and viral infections, and their global use should be discouraged, according to the UNSW study. Okay, so this is a study here that respiratory infection is much higher among healthcare workers wearing cloth masks compared to medical masks. Research shows cloth masks should not be used by workers in any healthcare setting, as authors of the new study state. So we're being told to wear masks, okay, cloth masks, and prevent the spread. And now we're hurting our respiratory. This is a respiratory virus, and we're potentially weakening that system. And now, has anybody considered the idea that that's why more younger people are now going into the ICU? Now, the other side I want to highlight about this is, how is it fair that I have to wear a mask, okay, a cloth mask that's hindering my respiratory ability, when I'm a healthy individual, I eat healthy, I work out all the time, I'm in an age group that is not deemed to be at risk, But now I have to wear a mask that's going to probably hurt my immune system and respiratory system, and therefore make me more likely to have an issue with COVID. So by me wearing a mask, which is supposed to help the susceptible population, which we deemed as 65 and older, I am now hurting my own health based on this study, which is by Science Daily. Okay, so this is again telling us that it doesn't make sense that you have it from the CDC website saying that the general public should wear this and the medical community should wear something else. Okay? Does that make sense? That's the question that we need to ask, right? Okay? And for you guys not concerned, so or for you guys that are unsure, medical mask versus cloth masks, okay? Cloth masks here, right? Medical masks we've got here, right? Medical masks. They're different, right? They allow for more breathing. That's why. Okay, so that's that. All right, so now let's go to, what is herd immunity? Herd immunity is also known as population immunity. It's indirect protection from infectious disease that happens when a population is immune either through vaccination or immunity developed through previous infection. The World Health Organization supports achieving herd immunity through vaccination, not by allowing a disease to spread through any segment of the population, as this would result in unnecessary cases and death. So what this is saying is that we can achieve herd immunity by vaccination or by natural immunity. As we've seen in years past in the history, we've achieved it through a natural immunity. Now, we've already gone through the process of saying that the at-risk population is people that are 65 and older, right? So what you're saying is that if they're at risk, then we should be vaccinating them and allowing the rest of the population to develop herd immunity through natural infection. Now, people can say that, there might be issues with mutations. If you allow it to go through the population, it may mutate. Well, the same thing can happen with a vaccine as well. If I pull up the next article here, okay. So COVID-19 vaccine. Okay. How long will it protect me? Will I have to get a COVID-19 shot every year? A few people who have had COVID-19 have apparently, this is coming from Hopkins Medicine. So John Hopkins, which has been, essentially tracking this whole thing from the beginning. A few people who have had COVID-19 have apparently had a second, often milder case of the disease, and researchers are exploring what this means in terms of how long immunity from the coronavirus lasts. Vaccine developers are looking at ways to boost the effectiveness of a vaccine so that it provides longer immune protection than a natural infection with the coronavirus. So they haven't even confirmed this yet, but we're being pushed that we should be using the vaccine is going to save everything, even though will the vaccine work if I've already had COVID-19 or tested positive for the coronavirus? So notes that people who have already had COVID-19 or tested positive may still benefit from getting the COVID-19 vaccination. There's not enough information currently available to say if or for how long people are protected from getting COVID-19 after they had natural immunity. Early evidence suggests natural immunity from COVID-19 may not last very long, but more studies are needed to better understand this. So they don't know this. So they're giving, again, where we need to put together the pieces here in the puzzle and say, so 14 months later, we're being told that we need to lock down and that natural immunity may not work, but it doesn't really affect most of the population. We're not even giving an opportunity to actually see if this is going to pan out for us, and that we need to risk ourselves by wearing masks or whatever. So if I get a coronavirus vaccination, do I still need to wear a mask and physical distance? Yes. It may take time for everyone who wants a COVID vaccination to get one. Also, while the vaccine may prevent you from getting sick, it is unknown at this time if you can still carry and transmit the virus to others. This is why, until more is understood about how well the vaccine works, continuing precautions such as mask wearing and physical distancing will be important. So even after you get the vaccine, there's no guarantee that things are going to return back to normal. Now, let's continue on. Why does the coronavirus change? The variants of the viruses occur when there is a change or mutation to the virus's genes. Ray says, this is Ray, these are guys, Stuart Ray, MD, Vice Chair of Medicine of Data Integrity and Analytics from Hopkins Medicine, and Robert Bollinger, MD, MPH. So anyways, these are infectious disease experts. Variants of viruses occur when there is a change or mutation, blah, blah, blah. Ray says it is the nature of RNA viruses, such as the coronavirus, to evolve and change gradually. Geographic separation tends to result in genetically distinct variants. Mutations in viruses, including the coronavirus causing the COVID-19 pandemic, are neither new nor unexpected. Bollinger explains all NRA viruses mutate over time, some more than others. For example, flu viruses change often, which is why doctors recommend that you get a new flu vaccine every year. So what this is probably alluding to is that you're probably going to have to get a coronavirus COVID-19 vaccine every single year, similarly to the flu vaccine, because there's so many variants, because there's so many mutations, and essentially that we're going to have to rely on the vaccine to get that every year, because we need to protect people that are 65 and older. Everybody needs to get the vaccine. Okay, this is saying, like I said, that it's mutate, and it's going to mutate whether there's a vaccine or not, right? That's how these viruses work. Now, you may be protected from it, but the key component here is, if you're vaccinated, you may be protected from it. The key component is you may not need the protection because your immune system is fine. Okay? Next, I want to talk about, now, we're taking this guidance from the government and, for the most part, policymakers that are making these decisions, that telling us what is the best way to go about doing this. Where, like I said, wearing masks, social distancing, using the vaccine, or whatever it is, because we're being told that that's the best thing to do. Now, there is disagreement in medical communities. There's disagreement all over the place. If you're saying that the science is saying one thing, that's not true, because I just showed you that it's not saying one thing. There are divided circumstances here. So what I want to point out is that if you are just taking the government at its word, that you're not thinking about this and saying, maybe there's some money involved, maybe that there's some people profiting off of this. This could be, certain parts of the medical community. It could be vaccine community. It could be politicians. It could be whoever. There are self-interests all the time at play everywhere. Okay, and when it comes to the history of I'm going to get back into the ICUs shortly as well. But when it comes to the history of our government, or what kind of information we've been given to draw conclusions for, our health or whatever, specifically we're going to focus on health, but it's not always the right information. We need to understand that. There can be wrong information that you're being given, and if you automatically assume that it's 100% correct, then you're wrong. You need to do your due diligence to understand that if you haven't looked at the data, you need to start looking at data and figuring it out yourself. And that's how I'm coming to some of these conclusions. So, cigarettes were once physician tested approved. From the 30s to the 50s, doctors once lit up to the pages of cigarette advertisements. You have an advertisement here with a doctor on it saying that he smokes. For a long time, physicians were an authority of health, and then we're still prompting for the use of cigarettes. You can see here, more doctors smoke Camels than any other cigarette. Now, like I said, this is an extreme version, but I'm just using this as an example of how ludicrous this looks now, right? But at the time, because we were presented with that information, the doctors have said it's okay, then it must be okay. Well, no, I guarantee you not every doctor was saying that, right? Okay, let's go to the next one. I have a picture here of the Canadian Food Guide. Okay, this is from 2007. Okay, it says grains. Basically, 6 to 7 grain servings per day. Milk alternatives. 75% of the population is lactose intolerant. But milk and alternatives are being prescribed 3 to 4 times per day. This is in 2007. Okay? And grain products. Bread, bagel, flatbreads, cooked rice, cereal, cooked pasta. We've got milk, canned milk, fortified soy veg or yogurt. So some of these on here are okay, but I'm a health professional. I've worked in the health field. I can tell you that without the reason why so many people are lactose intolerant is because they have the inability to digest lactose. because their digestive enzymes don't work. So we're being prescribed information to have dairy, for example, that we can't digest. We're being prescribed to have grains when sugar leads to obesity, can lead to obesity, right? If you're somebody that's insulin resistant, you don't want to be having grains, but this is on Canada's National Food Guide. This is the advice. You look at it now, it's completely different. It's been overhauled in 13 years. Okay, this was the advice coming from the top to tell you how to be healthy. Okay, you know what happens still? There's still farmers, there's still advertisements for milk because we want to sell milk for the farmers, even though most people can't digest dairy. Okay, does that make sense? No, it doesn't, but that's what's going on. Okay, so again, we need to take this with a grain of salt and use your own common sense to come to a conclusion as to whether what we're getting makes sense information-wise. Okay, connect the dots here. Now, this next one, okay, this is from Harvard Health Education. This is from February 15, 2021. Healthy ways to strengthen your immune system, okay? Don't smoke, eat a high diet in fruits and vegetables, exercise regularly, except we're closing gyms. So you're telling me that this is how you boost your immune system. Your immune system is needed to fight off the coronavirus without a vaccine and would attribute to us having herd immunity. But you're telling us not to exercise and not go to the gym or not even figure out a way to exercise where people can be in that environment and be fine. Okay? Maintain a healthy weight. Have you heard anything about people trying to lose weight over the past year because that's going to be important to their health? Have you heard about giving people Krispy Kreme donuts for their vaccination? But maintaining a healthy weight improves your immune system. So if we want to improve our immune system and fight the virus, then why wouldn't we want to promote losing weight? Drink alcohol. Drink only in moderation. Is the LCBO still open? Yes. Why is the LCBO still open if it's bad for your health? Get adequate sleep. Take steps to avoid infections such as washing your hands frequently and cooking. Minimize stress. I don't think anybody's stress has been minimized, but obviously you can't really do much about that in a pandemic. Keep your current with all your recommended vaccines. Vaccines prime your immune system to fight off infections before they prime your immune system. Healthy ways to strengthen your immune system. This comes back to your immune system. But all of these things on this list, we're not doing them. They're not even being promoted. One bit. Zero. All that's being promoted is a vaccine. That's it. We're not saying, hey, you should go out and exercise. Hey, you should make sure you're eating your fruits and vegetables. Have you heard of the head doctor of Canada speak on these things? I haven't. But I have heard of lockdown, social distance, wear a mask every day. Okay? Now, you guys know that I'm into the economic side of things. I haven't even touched on the economic side of things, and I can go so deep into this. We're literally setting ourselves back decades and decades and decades and decades from the economic fallout. So meaning that, people that want to buy houses or the younger generation trying to set themselves up for successful retirement. And when they retire, all of these things, right, from an economic standpoint, just from the money standpoint, then we haven't touched on the monetary system and how that creates wealth inequality and all the other things, like I said, I could dive into, but I'm not even going to do that today. I'm just going to focus on how it affects mortality. That what we're doing. U.S. risks years of higher mortality on COVID's economic fallout from lockdowns. Doesn't say that, but basically from lockdowns. Researchers say disease to have long-term health effects. Paper 1.4 million more Americans may die in the next 20 years. U.S. could see elevated death rate for more than a decade as the economic fallout from coronavirus persists, underscoring the long-term health effect and the impact of the deep recession. This is just America. This isn't worldwide. Okay, the nation's mortality rate is forecast to increase 3%, while life expectancy will drop 0.5% over the next 15 years, representing 890,000 more American deaths, according to working paper from researchers at Duke, Harvard, and Johns Hopkins University. Over a 20-year period, that amounts to 1.37 million additional deaths. that will disproportionately hit Black Americans and women in the near term, though may also carry long-term consequences for white men. For every 100,000 citizens, an additional 33 African Americans and 25 white people could die as a direct result of the economic impact stemming from COVID-19, the data show. So, is that from the virus? No, it's from how we're responding to the virus that is creating all of these deaths. More, though, that would be more deaths than that is currently occurred to date over the next 10 years that we're still going to be feeling whether the whole entire population is vaccinated or not. So again, we have an opportunity to create herd immunity with a population that is not susceptible to the virus, and we're not even taking advantage of that. We're just relying on waiting to be vaccinated when we're still going to have to get vaccinated going forward, and we're still going to have to develop a herd immunity. Regardless, we're still going to have to get herd immunity with 60 to 70%, whether you're for lockdowns or against them. So what are we doing? We're going to wait until we're all vaccinated and then get herd immunity when we don't even have to be doing that, really. Obviously, that's what stats tell us. Okay, on to the next one. We're almost done. Don't worry, we're getting there. Amazon announced its plan to build a new fulfillment center in Ajax. So the whole thing about, we need to lock down, the biggest argument about it was hospitalizations, right? And making sure that we don't overwhelm the healthcare system, right? That was okay, let me ask you something. Have we built any more hospitals in the past year, in the past 14 months? Have we built any hospitals? Any major changes? China built one in 9 days. I'm just saying. We have not. However, Amazon has built a warehouse right by my gym where I work. Amazon's built a warehouse. They started building it in August of 2020, September 9th, 2020. It was August that I remember it being announced. And we're in April now, and this thing is like built, completely built, basically. So 8 months later, essentially, we could have had, and this thing is bigger than any hospital that I've ever seen. We could have had a hospital built by now to, take care of, or a COVID-specific hospital to take care of this influx in our healthcare system. Have we made any changes to improve our healthcare system at all? No, we've just locked down, social distance, and wore masks and waited for a vaccine. But we haven't built a hospital. Now, what's the other side of it? Well, ICUs are getting impacted, right? Right? So ICUs are being impacted, right? So let's pull up ICUs. What's important about ICUs? Equipment and systems, quality of care. The available data suggests a relation between ICU volume and quality of care for mechanically ventilated patients. After adjustments for severity of illness, demographic variables, and characteristics of different ICUs, higher ICU staffing, this is important here, higher ICU staffing was significantly associated with lower ICU and hospital mortality rates. A ratio of 2 patients to 1 nurse is recommended for medical ICU, which contrasts the ratio of 4 to 1 or 5 to 1 typically seen on medical floors. So this is saying that if there is enough staff for the ICU, then people are more likely to survive. And the overflow of the healthcare system will be manageable if we have more staff. So there's the equipment, right? We need to have the hospital. We need to have the equipment that they need to use in the hospital. And we need to have the staff available, such as nurses, expert nurses, to deal with those issues. Okay? So have we tried to hire more nurses? That's the question. What are we doing about hiring staff, right? Canada is facing a nursing shortage. Here's why it's hard to fill the gap. Canadian nursing schools are seeing a surge in interest amid the pandemic, but experts warn it may not be enough to alleviate the shortage of people working in the profession. It's good news that we have so many applicants, but in some ways it's so really frustrating news because we get stellar candidates, but we only have 120 seats authorized by the government. UBC has seen 31% increase in the number of people applying to its Bachelor of Science in Nursing program over the last year, blah, 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 blah. Okay, so we're essentially saying that they are not hiring more nurses due to what's going on in the government, okay? That's not supposed to be conspiracy oriented. I'm just saying the government has done nothing to expedite this process. It's not just the number of spots in the nursing program that's contributing to the program. So there's a shortage of clinical placements available for students to get hands-on experience in hospitals or other healthcare settings. That's because many institutions are trying to reduce the risk of spreading COVID-19. So let me get this straight. We're putting less people into the nursing system because we don't want to expose them to COVID-19. How is that going to stop the spread of the virus or control the spread of the virus or take care of people that need the help if you're not allowing them to get the experience? In order to let more students into nursing programs, there would need to be more educators as well. And unfortunately, at the moment, there are more PhD prepared nurse educators who are retiring each year than we graduate new PhDs in Canada. Do you think that would be an incentive to provide to people that we need you? Hey, we need you to help. We're going to pay you. Instead of paying all this stimulus money out to everybody to sit on their ass or sit at home, we're gonna pay you guys, or we're gonna incentivize you guys to educate people faster. We're gonna get people into the program faster. We're gonna have more nurses. We can take more care of more people in the ICU. Therefore, our healthcare system is gonna be okay, and we don't have to rely on mass social distancing and a vaccine. Again, cause and effect. What are we doing? Why are we making these decisions? And who is making these decisions? It's our policy making decisions. It's in fact fantastic. 1 in 3 Ontario registered practical nurses considered quitting due to the pandemic because they're not getting the support that they need. There is a growing number of nurses that when the pandemic is over, they're seriously thinking of leaving the profession. So why are we not strengthening this industry? That's the point. It's obviously pretty clear it's important, but we're not doing we're focusing on lockdown and social distance, not improve the healthcare system. Okay, so those are the big things that I wanted to talk about. Okay, I'm gonna stop screen share for now. Okay, so this is what I'm saying. All these things that we just went through are alluding to the fact that we're making decisions to produce an outcome, and they're stupid ass decisions that make no sense. And the outcome that we're trying to achieve, we don't even know what it is. Are we trying to get a herd immunity or not? If we are, then why wouldn't we be utilizing the people that are most efficient and have the strongest immune systems to get herd immunity? Or are we trying to vaccinate the entire population? Is that what we're trying to do? Well, yeah, we want to vaccinate people to reduce the spread. But wait, why do you want to reduce the spread? Because there's been no clear, concise science that we can reduce the spread. There's some information coming out in Israel now that vaccination reduces the spread, but it doesn't matter because we need herd immunity. So basically, the whole argument is that we don't want to allow people to get it that aren't vaccinated because they may have mortality issues or there may be issues with them. And we're relying on the vaccine to protect them. But we have just seen from a full year of data that people age 15 and younger kill this virus. They handle it fine. Now you might say that, but there's other issues that may arise from it. Yeah, that's clear. There are other issues that could arise. We don't know yet. We don't know what issues could arise from using a different type of vaccine yet. We don't know what the long-term effects of this vaccine are going to be. We don't know if the long-term effects of the vaccine may cause mutations that are not good. We don't know that, what could happen with any child and anything that they experience in life and how that's going to dictate their future. But if it's the probabilities are saying 99.99999% that they'll be fine, and people in their 20s are going to be fine, people in their 30s are going to be fine, then why are we not allowing those people into the regular environment to get herd immunity? So this is why people are getting frustrated. This is why people are getting upset, and this is why I understand, because I've looked at all this big picture and said, okay, what are we doing and why are we doing it, and what is the desired goal, what is the desired outcome? Now, what is another potential solution here? So, number one, why have we not been given the opportunity to vote on whether we should or shouldn't be doing these things? right? Because as I have explained, it's not necessarily that this is for the greater good on one side or the other, right? There's a lot of negative cons, there's a lot of cons associated with lockdowns, and there are some pros associated with lockdowns, but the cons are seemingly outweighing the pros, right? So we need, if you're saying that you're forcing everybody to go and do something, but it's also negatively impacting them, then that's not fair. It works the other way. We need to lock down to protect a bunch of other people because, that action is going to protect other people, right? So for the greater good, but it works both ways. And so why can we not have a vote, okay, to say, we believe that we should open up and see how that goes. Now that may seem simplistic, but what I want to go further forward on this is say we do have that vote, okay, and 90% of an area that votes is for reopening, okay? There's 10%. Say the community is 2,500 people, and then 10% of those people don't want to open. Okay, that's 250 people. So we say to those 250 people, okay, you know what? We have a bunch of hotels out there that are not being used. Okay, we're going to take you 250 people and we're going to place you for 3 months or 6 weeks or whatever in this area so you can don't have to worry about your own health, right? We're going to get you out of that area. We want to, test run this opening up with 90% of people and see how it goes. But that 90% of people, what we're going to do is we're going to focus on them being under the age of 65 and they have no health risks because we want to develop herd immunity. So we want to allow these people because this is the whole point of herd immunity, like the Zika virus, for example, okay? It essentially opened up into the community, but the immune systems were able to fight it off and it died out. So that's the whole point. We open up with 90% where these people are under the age of 65, have no health issues. They don't, they're not battling cancer. They don't have immune issues and they're not immunocompromised or anything like that. And then we allow these people to go out into the workforce and do what they normally do in everyday life. No masks, no social distancing, just normal, right? And then we see what happens. And then those people are not affected that don't want to be effective. You don't want to participate in it. You don't have to. And then we move from there. Now, this isn't saying that we have to do this everywhere. It's just saying that if we take a provincial-wide vote or a municipal vote and come to that conclusion, then we figure out the logistics from there. This is just a random idea, but this is different than just lock down everybody and that's the end of it. Or wait for the vaccine and that's the end of it. Or not improving the healthcare system. Like all these other things that I've mentioned, we haven't tried. So here I am presenting another idea, and maybe it's not perfect, but if we fine tune that idea, then we can come to a conclusion that we all can figure out how to get by this and around this, instead of just saying, we're going to lock down. We're going to lock down. We're not going to work. We're going to print money. We're going to ruin the economy. We're going to, potentially ruin our young and healthy population. We're going to ruin generations to come. Let's think of something different. How about that? So if you think, hey, you know what, that's a good idea. Let's have a vote on whether we should reopen. And if that area is 90% in favor of reopening, but the 10% are not, let's make sure that we reopen with the right population that is not at risk, under 65, that is, not, like I said, maybe not significantly overweight, whatever it might be. There are certain circumstances. You guys want to open? Okay, you have to meet this circumstance. And if you meet that, then you can open in this area. If not, we're going to ask you to leave for 3 months because we want to see the results of that. If you're in favor of that, you think that sounds like a good idea, like and share the video. Because all we need to do is get enough people that are willing to willing to take part in that. So anyways, that's my take. Like I said, I'm not saying one person is right or not. I'm not saying anybody's stupid or not. I don't think that this is as simple as, black and white. There is a gray area, but what we're doing is not working. So let's have a conversation. Let's not hate each other. Let's talk about how we resolve this, because our leaders and our policymakers don't want to do that. They don't want to help us come to that situation. They want to give us a bread and butter, easy peasy fucking solution that is not working. But fear is not the way to get by this. Fear is not going to help anybody. What happens is looking at data and having conversations and leadership. You need all of those things.